We're going to talk about body talk. So, Irene, do you want to explain a little bit what is body talk?
I'll keep it as simple as possible. The word body talk. Basically, what it means is our body is talking to us 24/7 from the moment of conception. That means when the two cells meet. As a practitioner, when people come to me for body talk session, regardless of any kind of symptoms that they have, it can be a physical aches and pains, any type of Western diagnosis, emotional suppression or whatever. What is basically saying through all this, I call it symptoms, is the body is trying to tell us something like something is off inside. Yeah, so the body talk means your body's talking to you, what the body is trying to say, but we may not know exactly what is happening inside. Like there's an operating system inside. What's the story or unprocessed information? So what is it that the body is trying to tell us that we are not aware of? So that's in a nutshell what body talk is.
I heard of some body talk practitioners, right? Actually, besides in hospitals also to help to enhance those patients, right? Like physio or whatsoever to enhance their recovery. Is it true?
Yes, of course, because the idea is still the body knows what's best for itself. The thing is humans, we gei kiang we think we know, right? We go and do a bunch of stuff, right? Oh, because I read this magazine, this is good. Somebody tell me the scariest thing is so and so and so and so do that and then it is good and I follow. So it may work for the other person, but is it really what your body really needs? So when you do a body talk session, first is we can bring out certain awareness to the person, but on the bigger scheme of things, the person is more aware of what he or she needs. So in that context, when someone has body talk and then at the same time they do physio or any other Western treatment, the body is more in tune to what is needed. And when you do that particular treatment, then you are aligned with the treatment, right? So when you say physio, so if someone is having a body talk session within the hospital context, the body is already prepared to do those exercises rather than you do it mechanically and then there's resistance either emotionally or whatever. So it's like waste time, waste money lah.
So body talk will help to lift up or take away or trying to help you cope with the resistance that you're having in order to accept the therapy that you are supposed to receive.
Correct. That's the simplest one that we say that we want to
layman term.
Yeah, I mean the symptoms will go away once we establish or heal the cause. Do both. So the physio part is you can say using example physio, right? So it helps physical level, but we want to make sure that whatever underlying story is also being addressed at the same time. So those treatments that people do on the external, we see that the results amplified.
There are people who know something about body talk, or they go for what we call alternative healing or holistic healing. But then there are some people who have the misconception that all this that if they go to all this body talk or energy healing stuff then they don't need to go and see doctor, whatever, if they're sick or whatsoever. Definitely it's not like that, right?
Definitely not. I personally do encourage to work with whatever that you're doing, especially to enhance. And then normally, just use Western medicine. We know that it works well and fast. But we're not merely wanting to get rid of symptoms, right? We want to make sure that, of course, we don't want to live with let's say it's a migraine. We don't want to live and struggle with migraine. So we'll take the medication if necessary, right, to help cope with the symptom. And at the same time, you do body talk, you clean up all your, I don't know, if you're 30 years old, you have 30 years of baggage to clear.
When you say baggage, you are talking about all the emotional baggage, right? The trauma since young, the belief system.
Right? Correct. But what works well for you when you are 3 years old may be, harmful for you right now.
Okay, one thing I want to clarify is body talk practitioners, right, are not doctors. So we same like animal communicators, we don't diagnose for you what illness you have, what thing you have, and then tell you to eat what medicine or even like even if I ask you to drink more water, it's also a kind of diagnose and a kind of a prescription which we don't do. So I just want to make clear everybody understand this is it. All right. So what happens during a body talk session? Like client comes in your door, then what happens?
Client comes in the door, they will have to fill up an intake form. Then I explain in, let's say, 5 minutes. If you have questions, what is body talk, clear that part. You lie down on a massage table. I would probably say 8 out of 10 of people fall asleep. Because you see, we're not working with the subconscious mind. I'm not verbally asking you questions, right? Of course, there's a system for us to get information from the body. That's too technical for us to talk about tonight. But that means that we are consulting your body's own, operating system. This thing that the word that we use is called priority. Like, what do you want? It's almost like asking your body, what you want to do right now? What you want me to do for you, right? So the body will give me the so-called that process. So I'm not doing reading whatsoever. So there's certain process that needs to be done, or healing, or which word.
So you ask all the body part lah.
Questions that we ask includes physical. Certain organs or body parts may not be functioning, operating at the optimal level. So the information that we want to take is, yes, it includes physical body. So it includes also the Eastern medicine concepts with meridian flow. We also deals with things like psychology, like you say, the belief systems. There's also the emotional element. There's also the environmental element, which means that people, even outside, your animals, your plants, your environment, our environment affects us, who we are, and affects our health tremendously more than we can ever imagine.
So I'm going to ask her a little bit of emotional health today, emotional well-being, like how to support subtle emotions to flow.
Especially now, right, the past 2 months, right? It's like we all cooped up, in our house. So the idea is this period actually brings out a lot of our issues. So the issue is already there, right? The emotional, whatever is already there inside. It's just that, being at home in a short period of time, it amplifies our issues. So I think what Angie was trying to say was, how can all these cooped up emotions eventually can lead to a physical problem? So that was something. The first thing is, even when we have emotions, right, we are not even expressing it. We're not even giving ourselves that time, for our body to heal itself. Body is designed to heal itself. But if you're not even giving 10 minutes a day for ourselves, self-heal how to take place? Because we do so much for other people. Either if you're working,
say, God lah, I sleep that time is my me time lor. When I play handphone that time is my me time lor. But then like in between, throughout, like from the moment you wake up, maybe 6-7 a.m. until the time you finish work, 5-6 p.m. and then you go home and settle. Let's say example, most of the people here have kids, right? So you need to go home, settle kids lah, cook lah, check homework lah, things like that. By the time you have time for yourself, you are already very tired. That's what a lot of people say. Then one of my excuse is I work from morning to night. By the time I go home, 10:00, 11:00, I have to settle my own animals. I also don't have time.
Correct.
So so I find that making time for ourselves is really very important. Even that 5-10 minutes. Yeah, right. It's like everybody is giving time away, giving their powers away, giving their time away, to giving their care and love away, but give everybody here there A, B, C, D, E until Z, but forget about ourselves. So maybe it's good that you treat you as alphabet A instead. Yeah, put yourself as the alphabet A. Since you want to give away, you give away to yourself, lor. Give the love, give the time to yourself. So you put you as the alphabet A. Wow, I suddenly come out this concept. Wow, I shocked. So put yourself as the alphabet A. Give yourself first, then you go B, C, D, all the way to Z.
Because you see, when we do that, there's this term called secondary gain, right? We expect something in return. We are humans. This is a duality world. Our brain is divided into two halves, right? You do something, there needs to be an interesting energy exchange. we get very exhausted and tired. The tank also empty. So when that happens, a lot of interesting emotions starts to bubble to fill up the empty tank. Right? So we get either you say suppress or repress or whatever word, it's all in the pot of soup. So the
Yeah, so end of the day we become very angry, very
exactly,
frustrated, very pek. Then and you end up venting your feelings on your kids, on your spouse.
yeah,
Some people even vent it on animals.
exactly.
Yeah, and the best part is animals don't know how to 照.
You cannot
Still
tell, right?
come out there and let you see and let you vent and
Correct.
scold this and that. Irene is more of a human being person, but I'm more of an animal person. So what we're actually trying to do is we're trying to integrate the human and the pets together, because both sides are interlinked. What you feel, they will feel. Okay, what the HB feel, human being feel, what the pets will also feel. End of the day, right? It will affect each other. We have to check back on ourselves so that we see what's happening with our life, our problem, our emotions that's affecting your kids. Tiobo,
Yeah.
sorry, I talk too much.
No, no, no. I mean that's true. I mean earlier on I was saying your environment affects
Mm,
other, right?
yeah, definitely. So it will not only affect animals, it will also affect your human being kids, your young
Exactly.
kids.
Yeah.
And then said, wow, mommy, I never do anything. Why I got do my homework? I got help with the housework. How come you still angry with me? I don't understand. But
Mm,
it's something that you cannot control because you need somewhere to vent. So
correct.
how Irene is going to help us, right, is to um, help us to learn how to cope with this stress, with this emotion, okay? How to learn how certain techniques that we can learn to settle ourselves. That's why I say self-care is very important to help us during this circuit breaker time, before all those people like husband and wife, they quarrel, domestic violence, and then people ill treating their pets because why? Because they are not used to every day at home with things. So how to cope with all this pent up frustration and things like that.
Domestic violence doesn't necessarily include physical violence.
Mm.
Verbal abuse is also, very, very serious. The emotional hurt is not something that you can take Panadol and go away. It stays there for many, many, many years and, can even pass down to next generations. Simplicity, it is basically, like your computer and your handphone, system hang, press the reboot button. Yeah, so there's one very simple technique that everyone can learn. It's called the cortices technique.
So
Correct.
I'm going to put Irene on full mode so that you can see properly what is the cortices technique. Irene, please.
So what we are doing with cortices is you're only going to use your hand. Yeah, you're going to use your hand, and while we're doing the technique, you will be breathing throughout the process. So you take nice, slow, deep breath throughout. You're going to start with either hand is fine. One hand, you're going to put at the back of your skull or your head here. Your other hand that is free, you're going to be doing some tapping. So you'll be tapping over 3 places. So when you tap your head, you want to spread your finger. So you touch both your hemisphere. And then you're going to alternate with tapping your chest area or your sternum, your chest bone. And then the third place you're going to tap is your on top of your navel. See it? Yeah. So one hand position, one place where the hand is. The other hand, you're going to tap the head, the heart, and then the gut, and then you're going to breathe throughout the process. Yeah. So I'm going to show you the whole thing. So take 2 full breath, and then I'm going to move this palm up, and then this hand is going to continue tapping. Okay. Heart. It's the second breath. You move one palm up. You keep moving from back of your head until you reach the top of the eyebrow. And remember, each hand position is 2 full breath. last one, and cover the top of the eyebrow. So you've gone from back to front, and the last part is you're going to touch both sides of the brain or the hemispheres. So you only have one pair of hands if you're doing on your own. So you're going to remove one hand just to do the tapping, like borrow the hand there. And just borrow the other hand just to give it a nice balance. That's it. I know I do and talk at the same time, but this will take you like what? If you do it a minute or less.
1 minute.
Yeah, approximately a minute.
Maybe you want to explain, the hand put here means what? Here, put here, what? Then tapping here and here and here, and the gut means what?
Okay, what? So where your hand is, right? Firstly, where your hand is basically telling your body, mind, or your system to focus on that area. BodyTalk, this fundamental philosophy that I just want to repeat or remind you, we are saying that the body can heal itself. Right, so this is a technique, and the interesting thing is human, right? Like say you run all over the place every day, right? 24 hours or so not enough to use. So when we are busy and put our focus externally, out there, we forgot ourselves. Your body also forget that it can heal itself. That's where we go into this fight and flight and all this emotion don't know how to release. We want to remind the body that it can heal itself. So when we tap this part of the brain, basically saying, hey, hello, go and look at this area or wherever your hand is. Right, and go and balance that area. And then when we tap the sternum or the heart, it means like store the changes. You take out a file, you make your changes, you got to click save, right? Otherwise, that's why body, even if you do the courses every day, it will have a long term, it will have a very, very interesting long term effect. You got to do regular because you're going to remind your body. Because every day, it's like you clean your house today, few more days you have to sweep again, right? So life goes on. We have issues. So ideally you do it every day. So when you tap your sternum or heart, you store the change so that we don't linger and like most of us, you have problems. You can see the pattern keep repeating. It could be weeks, sometimes months, sometimes for people years, right? Same problem, especially with relationship. You don't sort it out. You keep attracting the same similar pattern of people in your life, right? So when I clear that underlying pattern. Right, so that's the tapping on the sternum. We save whatever that we have made changes to, and then the last part, when we tap the gut, it basically means the more recent research that the scientific research that was come out that there is this thing called the gut brain. Right, there's the intellect. Actually, our intellect stays with the gut and not the head. We just give too much power to the head. So it's actually we have three brains. The head and the heart and the gut. So we're going to tap that to update. So when we tap the gut, it basically means that integrate this change to the entire system. Come back to where the hands are. So we have four main lobes. The back here is called the occipital lobe. The down here middle is the parietal. This is frontal. This is temporal. Basically, very simple. On the back of the head, occipital means it governs our sight. So it deals with, on a physical side, it helps to govern with our visual. But on a consciousness side, the visual also represent what? Our perspective, our views, our opinions. And we put our hand, you can see that we put it right in the middle. Means we have, our brain is also divided into two hemispheres, the right and the left. So we want the both right and the left of each hemispheres to be in sync. We don't want to have biased perceptions. This is good, this is bad, Yeah, so right in the middle here is called the parietal, which governs movements, like hand movements, voluntary movement, involuntary movement. On the consciousness or the more bigger picture is your actions, your behaviors. Are you in a state that I'm in control? Like Angie was saying, right? You have a choice, or you want to live your life as if everything no choice ma. The frontal lobe is dealing with thinking and higher thinking. So most of the time is this is stress, right? The headache and all the stuff is mostly on the frontal lobe. Right? So that's the thinking side. So we also want to be a little bit more neutral. And then on the sides, this part of the head that we cover is the temporal, and this is also the emotional brain, the limbic brain also sits inside. Yeah, so we're going to cover the entire brain, left and right, so that we are more integrated, we are more calm. So seriously, nobody can tell you don't be angry, lah.
It's like when you're angry, right? People tell you to don't be angry. It's like you make me even more angry, because you are
Correct.
not. Yeah, it's like everybody you're not in my shoes. So how you, if this thing happened to you, you can do angry man. This is your YouTube on cortices. To be frank, in the beginning, because I trying to get uh get away from my so-called reprogram myself. When I'm tired, when I'm grooming whole day, then in between I tired, I tap. When some people make me angry, I tap. Uh, when I feel upset and suddenly the past come out, then I feel upset, then cry, so I tap. I cry finish first, then I tap lah, because must release the the emotion first lah. Yeah. So work stress, I tap. No business, I also tap. No business, no money come in, no income. So worry. So when
Was
you're worried, you
effective.
tap. So it's a very good technique actually. And then there's another more enhanced one, but we don't talk about very complicated one. So a little bit more enhanced one is a 1 day class that we call BodyTalk Access. It will all the techniques that is being taught by Irene, right, will be able to help you to strengthen this as I was talking about this energetic field that we call the Wei Qi, the energetic field surrounding your body to protect your body. Yeah. So how to inflect, this is one of the ways that these are one of the ways that we're going to talk about, like to cover today, on how to release whatever emotions that you are feeling, because you are having more interaction with your people, family members. And then if you are being more aware and how you are feeling, so it will also help. If your pets keep falling sick, it will also help them in a way. But as we said and we mentioned, this is nothing to do, this is not a replacement for going to see a doctor, okay? Because we don't diagnose, we don't tell you, hey, babe, no need to no need to see doctor, do cortisol scan already, where got like that one, fever sure go down, no such thing.
I know we sounded as if body talk is about fixing problem, but if you have no issues, also can tap for refresher. Just like when I'm getting ready, let's say even for tonight's talk, right? So I also tap my cortices before that. Just make sure that I am clear. Message that I'm sending out is clear. Be more prepared, be more centered, and be more present. That's also very nice. Kids going for exam,
Yeah.
start to prepare, within the 1-2 weeks before the exam, especially when they are studying. Again, it's me as a student, I know that I can study very hard, go to exam hall, blank. The body can heal itself. The body is also designed to protect us.
So slowly we learn how to release the fear in us, in whatever things that we do, or in whatever situation that we face. So body talk helps in this way, that learn how to cope in a situation that really there's nothing you can do.
I know the conscious mind, right? There's nothing. There's a lot of times, like even emotion, like you feel angry, you scream at whoever. It's not like you got nothing better to do and go and scream at somebody, right?
Yeah.
So you can't help it. But what you can help, you can do is do this technique, just tapping, just so that's very clear, right? What you can't do or control, and what you can
I think
do.
one of the questions people will ask is, wow, but when you are so angry with somebody, right? Wow, 你已经气到头上 already, you still go and tap, you still go back and remember go and tap.
But yes, if you're bursting with anger, you have to express that whatever comes out, and then after that, if you can, 1 minute, go tap your cortices.
If you want to know more about body talk, you can message or PM Irene. Just search for Irene Khor on her Facebook. So if you want to read more and know more about body talk, So you can go to Irene's website, www.bodytalk.com.sg. Very easy to remember. Okay. She has this Body Talk Access class that's coming out on the 30th of May.
At least for circuit breaker period, so we've got the license to teach online until August. So yes, so it's it's a 1 day workshop, but because it's online, I break it into 2 parts, so it's more digestible. So it's on Saturday and Sunday, 1 to 4 p.m., May 30th and 31st.
30th and 31st.
Yeah, on Zoom, and it's per household. Means
per household.
it's MCO, CB or MCO rules lah. Don't ask your cousin from neighborhood, then I'll get caught by the police, right? So whoever is already living at your home, whoever is living in the same household.
So please go to this www.bodytalk.com.sg to see look, and then sign up. It's really worth it because I pay for one person, you pay for one whole family, and some more cheaper.
What happens after the workshop? Within 2 weeks after the workshop, so we're doing it end of, you finish at May 31st, right? So until June 15, each of the participants can connect with me and we'll have a private Zoom, at least 30 minutes, to find out what's going on with you. Like, let's say if I saw Angie back then, right? Or she's going through this patch. So we'll discuss how else and how best Access can help, because you already know the tool, right? So we like a mini coaching, you want to do it. So it's still...
I like coaching.
I like the personal touch. Rather than teach, then it's like, don't know, get it or not, right?
So thank you very much for joining me, and then please go to bodytalk.com.sg to take a look and know more about Body Talk. If you have any queries, I'm sure Irene can help you. Okay, before you want to decide whether you want to have a session or not, maybe you just ask a question or something if you don't want to talk openly. Okay, so thank you very much, Irene. Mama, you can go and eat already.
Thank you, everyone.
Okay, bye-bye.
Bye.
Bye-bye. Hi. So, right. I have to thank Irene for helping with this interview. Like I say, I really, really hope that this talk about self-care can help you, because it really, really does help with our animals also, because remember I was talking about in one of my life that when I was sick with cancer, and then I keep telling my animals that don't worry about me, don't worry about me, everything will be fine, you all have to take care of yourself. So, and then at the same time I'm doing my own self-healing to make sure I'm emotionally stable. Physical I cannot help lah. Physical I have to entrust my body to the doctor, right? So I have to do my own job. I have to make sure my emotional health is there at tip-top condition, so that number one, my own body can heal better together with the doctor's help. Okay. Number two, my kids at home do not fall sick. If I get very upset and things like that, right? Because there are a group of people helping me to look after my animals, because I wasn't home for like 4 months. So I couldn't come home for 4 months. So last thing I want is my animals to fall sick, because once they fall sick, okay, I think when I got cancer, right, I'm more worried about my animals than myself. Right? The first thought that came to my mind was, what will happen to my animals? Who will take care of them if I die? That kind of thing. But after that, we push that aside, and then I start working on myself. Okay, and I keep, as an animal communicator, I keep talking to them. It's okay, it's fine, I will be back. You just stay with who for a while. They will look after you, that kind of thing. So it's really very important that you look after yourself, because imagine if I'm in the hospital and then if my animals are sick, right? How to 放心, right, to actually recuperate? I don't think so. It's so easy. And then the worst part is, wow, you helpless there's nothing you can do at all. So I work so hard on myself, I tap everything to make myself emotionally stable so that I can heal properly together with my doctor's care. I mellow a lot, my thinking changed a lot, and especially last year after the near death experience, how you see things, right, and how you think is really different already. It's really different from those normal people who have never been that kind of experience before. It's totally different already because you really become more aware, and then you wow, 真的 if people say see open really see open. Still got a bit 心胸狭窄 lah, but then you really see open a lot. So but I'm still working on it. The thing is you need to do your homework. You keep work on yourself in order to be the person that you want to be. Thank you very much, everybody. Have a good night. Bye bye.